If you are over 70 and you cannot sleep through the night, there is a good chance something you are already taking is making it significantly worse. 6 of the most commonly prescribed medications for people your age are known to interfere with sleep, and they are so common that almost nobody connects them to the problem. We are going through all 6 right now, so you can find out if yours is one of them. Number 6. Diuretics. Water pills, also called diuretics, are prescribed for high blood pressure, heart failure, kidney disease, and swelling in the legs and feet. If you are on one and waking up multiple times a night to use the bathroom, there is a very good chance your medication timing is the entire problem. If you have ever gone to bed exhausted, fallen asleep within minutes, and then been yanked awake an hour later needing the bathroom, and then again an hour after that, you know exactly how demoralizing that cycle is. You are lying down between bathroom trips, not actually sleeping. By morning, you feel like you never went to bed at all, even though you were in bed for 8 hours. And the cruel part is that you are doing everything right. You are going to bed early. You are trying to rest. But the medication is working against you in the dark hours when you have no idea it is happening. Diuretics work by pulling excess water from your body through increased urination. If you take your dose in the evening, your body is doing most of that work between 10 p.m. and 4 a.m. Every trip to the bathroom breaks your sleep cycle, and it takes time to drift back down into deep sleep before the next trip pulls you out again. By the time morning arrives, your body has never had a full, uninterrupted block of rest. This is why you wake up exhausted even when you technically slept. After 70, your kidneys already produce more urine at night than they did when you were younger. Your bladder also holds less than it used to. So before a diuretic even enters the picture, nighttime urination is already more frequent. When a diuretic is added to that baseline, the effect multiplies. 3 or 4 bathroom trips becomes 5 or 6. Sleeping an hour at a stretch becomes 40 minutes. Ask your doctor about moving your diuretic dose to the morning. If you take it at 8 a.m., your body processes most of it during the day when you are already awake. By bedtime, the peak effect has passed and your nighttime urination drops dramatically. Most people who make this one-timing change report sleeping through the night within a day or 2. The medication stays exactly the same. The dose stays exactly the same. Only the clock changes. For something that has probably been robbing you of sleep for months or years, that is a remarkably simple fix that a 2-minute conversation with your doctor can unlock. It is worth bringing up at your next visit or even calling to ask about sooner. The next medication on this list does something different. Where the diuretic just wakes you up mechanically, this one gets into your brain chemistry and makes it nearly impossible to settle down in the first place. Number 5. Antidepressants. Antidepressants, specifically a type called SSRIs, are among the most commonly prescribed medications in America, especially for people over 70. SSRIs are mood-regulating medications with names like fluoxetine, sertraline, and paroxetine. Millions of people take them every day. And a significant number of those people have no idea that the medication they are taking for their mood is the same medication destroying their sleep every night. Think about how cruel that is for a second. You start an antidepressant because you are struggling emotionally. You want to feel better. And then you spend the next few weeks lying awake at midnight with your mind racing, feeling more wired and anxious than before, wondering if something is getting worse instead of better. A lot of people blame themselves at that point. They think their anxiety is too bad to treat, or that the medication is not working, or that their sleep problems run deeper than they thought. Some people stop taking the medication entirely because they cannot connect what they are feeling at night to what they started taking in the morning. What they are not told often enough is that the medication itself may be causing the sleeplessness, and that a simple adjustment could change everything. These medications hit your sleep in completely different ways. Fluoxetine is activating, meaning it stimulates the brain and commonly causes insomnia, especially in the first weeks of use. Paroxetine is more sedating and actually tends to help people sleep. The problem is that doctors often choose based purely on which one works best for depression or anxiety without thinking through the sleep effects. So, you might end up on the exact medication that worsens your sleep simply by default, not because it was the wrong choice for your mood, but because nobody thought to consider your nights. After 70, your nervous system is far more sensitive to medication changes than it was in your 40s and 50s. When you start one of these medications, your brain chemistry shifts as it adjusts to a new chemical balance, and that adjustment period can stretch from weeks into months. If you are also on other medications that affect sleep, it becomes nearly impossible to sort out which one is doing what. If you started one of these medications recently and your sleep has fallen apart since, bring it up directly with your doctor and ask about the timing. Taking it in the morning gives your body the whole day to work through the stimulation before you try to sleep. If the timing adjustment does not help, ask about switching to a less activating option. Paroxetine is worth mentioning by name because it tends to be more sedating and might actually help rather than hurt your sleep. If your current medication is genuinely helping your mood but gutting your sleep, another option in the same family might do both. That conversation is worth having. A lot of people suffer through months of broken sleep on an antidepressant because they assume sleep problems are just part of dealing with depression. Sometimes they are. But sometimes, the medication is the specific problem, and a different medication would fix it. You do not have to choose between feeling okay during the day and sleeping at night. This next one is something most people do not connect to sleep at all, because they think of it as a temporary thing, something you grab when you have a cold, but it can wreck your sleep just as badly. Number 4. Smoking cessation drugs. Nicotine patches, Chantix, and Wellbutrin are all designed to help you quit smoking. Quitting is one of the best things you can do for your health at any age, but these medications carry a side effect that catches a lot of people completely off guard. They make sleep very difficult. And for people over 70, that effect can be severe. If you recently started a smoking cessation medication and your sleep has suddenly collapsed, what you are probably feeling at night is a kind of full-body restlessness that is hard to describe. Your mind is not racing about anything in particular. Your body just will not settle. Lying still feels almost uncomfortable. You want to sleep, you are tired, but something in your system feels switched on and will not switch off no matter what you do. Some people describe it as feeling like they drank strong coffee at dinner time. Others say it feels like low-level anxiety with no particular source. You might lie there for an hour or two completely unable to understand why sleep will not come, especially when you are doing something as healthy as trying to quit smoking. All 3 of these medications stimulate your central nervous system. That stimulation is precisely what reduces your craving to smoke during the day. But at night, when your body needs to wind down, that same stimulation works directly against sleep. Nicotine mimics adrenaline. Chantix activates the brain's reward signals in ways that are arousing rather than calming. Wellbutrin is an antidepressant that works through nervous system stimulation. They are all doing their job. They just never clock out. After 70, your nervous system takes much longer to recover from stimulant effects than it did when you were younger. A nicotine patch that might have kept a younger person awake for a few hours can keep a 70-year-old awake most of the night. Your sleep cycles are already lighter and more fragile with age, and adding a central nervous system stimulant on top of that leaves very little room for deep sleep to happen. This puts a lot of older adults in an incredibly frustrating position. They are doing exactly the right thing by trying to quit smoking. Their doctor is supportive. And yet every morning they wake up feeling wrecked because the medication that is supposed to improve their health is destroying the sleep their body needs to actually heal. If your sleep has been badly disrupted since starting one of these medications, talk to your doctor about timing adjustments. Removing your nicotine patch before bed, rather than wearing it overnight, makes a meaningful difference for many people. For Wellbutrin, taking the dose in the morning rather than the evening helps. Your doctor may also be able to suggest alternative approaches to quitting that are less disruptive to sleep. Quitting smoking matters enormously for your health. Getting enough sleep matters just as much. You should not have to sacrifice one for the other. What comes next is the one people dismiss most easily because they only take it when they have a cold. But for people over 70, it can be one of the most immediately disruptive things you put in your body before bed. Number 3. Decongestants. Pseudoephedrine, the active ingredient in Sudafed, and phenylephrine are in almost every cold medicine, allergy, tablet, and sinus product on the shelf. They are available without a prescription. They work fast, and most people reach for them without a second thought when they are congested. The problem is that they do not just work on your nose. They work on your entire body, and what they do to your heart and nervous system makes sleep almost impossible. If you have ever taken a decongestant in the evening and then spent the next few hours wide awake with your heart beating noticeably faster than normal, feeling anxious or jittery without any reason for it, chest feeling slightly tight, mind buzzing with nothing in particular, that was the decongestant. You probably thought you were just having a rough night, or that your cold was making you feel off. The medication was the actual cause. Decongestants shrink swollen blood vessels in your nasal passages by constricting blood vessels throughout your entire body and stimulating your central nervous system. Your heart rate jumps, your blood pressure rises, adrenaline floods in. Your body is put into a low-level alert state that is the direct opposite of what sleep requires. And unlike caffeine, which clears your system in a few hours, pseudoephedrine stays active in your body for 9 to 12 hours. Take it at 6 p.m., and it is still actively stimulating your system at 3 a.m. After 70, your cardiovascular system is more sensitive to stimulant effects and takes longer to recover from them. That racing heart feeling lasts longer and can feel genuinely alarming. A lot of older adults who experience this lie awake, wondering if something is wrong with their heart, when the actual cause is a cold tablet they took 6 hours earlier. If you are also on blood pressure medication, decongestants can counteract it directly, pushing your blood pressure up at exactly the time of night it should be coming down to give your heart a rest. The combination is not just disruptive to sleep. It is hard on your body in ways that compound over time if it keeps happening night after night. When you have a stuffy nose and you are over 70, saline nasal spray is a genuinely effective alternative that clears congestion without touching your nervous system. If you feel you absolutely need a decongestant, take it before noon. Giving your body 9 to 12 hours to clear it before bedtime makes a real difference. The congestion will still clear. Your sinuses will still drain. But your heart will not be racing at midnight, and your nervous system will have had the hours it needs to calm down before you try to sleep. Never take it in the evening and expect to sleep well. But the medication right before number 1 is one that most people over 70 are on every single day without realizing it is quietly stealing their deep sleep every night. Number 2. Beta blockers. Metoprolol, atenolol, and propranolol are beta blockers prescribed for high blood pressure, heart conditions, and irregular heartbeat. They are one of the most widely prescribed drug classes in people over 70. If you are on one, there is a real possibility that it is affecting your sleep in a way that is difficult to trace because the effect is subtle and builds gradually. Beta blockers do not usually make you feel wired or keep you from falling asleep. What they do is quietly reduce the quality of the sleep you are getting. You might sleep 7 or 8 hours and still wake up feeling unrefreshed. You might notice you are dreaming more vividly or having nightmares more often than you used to. You might feel like you are always sleeping lightly, like the slightest sound wakes you and going back to sleep is harder than it should be. If that has been your experience since starting a beta blocker, the medication is almost certainly involved. And the reason this is so hard to identify is that it does not feel like a side effect. It just feels like you are getting older. You assume your body has changed. You accept it. But for a lot of people on beta blockers, that decline in sleep quality is not inevitable at all. Beta blockers suppress your body's natural production of melatonin, the hormone that tells your brain it is time to sleep and keeps you in deep sleep through the night. With lower melatonin, your sleep becomes lighter, your deepest and most restorative sleep cycles are disrupted, and your brain loses the signal that anchors your sleep-wake rhythm. The hours you spend in bed look the same on the outside, but the restorative depth of that sleep is being quietly eroded every night. After 70, your body already produces significantly less melatonin than it did when you were younger. That reduction is one of the main reasons sleep naturally becomes lighter and more fragmented with age. When a beta blocker further suppresses melatonin on top of that age-related decline, the combined effect can reduce your deep sleep to almost nothing. A lot of people chalk this up to getting older and accept it as inevitable. For many people on beta blockers, a medication adjustment could change that picture entirely. Ask your doctor about taking your beta blocker in the morning rather than at night. When you take it in the morning, your melatonin has the entire evening to recover before you go to bed, which can meaningfully improve sleep quality. Ask also whether an alternative blood pressure medication might be appropriate for your situation, because some blood pressure medications do not affect melatonin the way beta blockers do. If a melatonin supplement is something your doctor thinks is appropriate, even a low dose taken about an hour before bed can help partially restore what the beta blocker is reducing. And now, number 1. The medication that does not just affect sleep as a side effect. It directly mimics the hormone that is biologically designed to keep you awake. Number 1. Steroids. Prednisone is one of the most commonly prescribed steroids for inflammation, joint pain, asthma, lupus, and a long list of other serious conditions. It is a powerful medication, and for many people, it is genuinely necessary. But if you are on steroids and lying awake every night despite being exhausted, there is a direct biological reason for it, and it is one of the most well-documented sleep disruptors in medicine. If you are taking steroids and lying awake at night feeling completely wired, mind racing with nothing in particular, exhausted but unable to turn your body off, legs restless, heart beating slightly harder than normal, that is cortisol doing exactly what it was designed to do. Steroids like prednisone are synthetic versions of cortisol, your body's primary stress and wakefulness hormone. Cortisol is supposed to be highest in the morning to get you up and lowest at night so you can sleep. When you take steroids in the afternoon or evening, you are flooding your system with a wakefulness hormone at exactly the moment your body is trying to wind down. Your nervous system responds the only way it knows how. It stays awake. After 70, your cortisol rhythm is already less stable than it was when you were younger. Your body does not regulate the natural rise and fall of cortisol as efficiently, which is one of the reasons why nighttime waking becomes more common with age even without medication. Steroids override that weakened rhythm entirely. Your body cannot fight it because the hormone telling it to stay awake is also the hormone it uses to manage every stress response in your system. The single most effective change you can make is timing. Ask your doctor about taking your full steroid dose first thing in the morning. When prednisone is taken at 8 a.m., your body processes it throughout the day, and cortisol levels follow the pattern they are supposed to follow: high during daylight, declining by evening, low enough by bedtime to allow sleep. Many people report sleeping noticeably better within the first night or two of switching to morning dosing. If your dose needs to be split, morning and midday is far better for sleep than morning and evening. If you have been on steroids long-term and have accepted broken sleep as simply part of the deal, it is worth going back to your doctor with sleep quality specifically on the table. For some conditions, there may be alternatives or lower doses that manage the condition while being less disruptive. For others, there may not be. But that conversation is worth having, because the cost of years of broken sleep to your overall health is real and significant. Poor sleep raises inflammation, weakens the immune system, and accelerates cognitive decline. If a medication is already managing one health condition, allowing it to silently damage your sleep is trading one problem for another. Now, we want to hear from you. Have you experienced sleep problems after starting one of these medications? Which one surprised you the most, or which one are you currently taking? Tell us in the comments below. We read every single one. And if you found this helpful, please give this video a like and subscribe so you never miss what we cover next. Thanks for watching.